Hi, I'm Lisa McCoy. I'm a registered dietitian with the University of Maryland Extension. And today we're going to talk about the new dietary guidelines for Americans. And this is something that comes out every 5 years. It is published by the United States Department of Agriculture, the USDA, and it's really some guidelines to help people, give them recommendations on how to eat healthier and what they should be doing to improve their health. And it's now for all stages of life, from young children, infants, to older adults. So today I'm going to talk a little bit about what their recommendations are for older adults, because that is important to know, that you want to be healthy as you get older. And the one good news is that the study showed that actually older adults tend to have healthier diets than other adult populations, but they also tend to drink less, so they're more likely to become dehydrated. They designate an older adult as someone who is 60 years or older. So the recommendations we're going to talk about today actually span that whole range, but you can imagine that someone who is from 60 to 70 has some different nutritional needs than someone who is in 90 or older. So it's a large range of recommendations. So really one size does not fit all. And we'll talk a little bit about that as we go along and what you should be thinking about. So first, the minimum recommendations that they're recommending is that we need to eat more vegetables, we need to eat more fruit, and we also need to increase dairy. And the reason that the older adults, they recommend increasing the dairy is for the calcium. Now, if you're someone who does not like dairy or does not consume that much dairy, then the recommendation is to try to get your calcium from other sources. And some of those could be some fortified foods like orange juice that is fortified with calcium, or it could be some fortified foods that are like breakfast cereals that have fortification in them. Or you can have it from some vegetables like greens, like kale, spinach, collard greens that are higher in calcium, as well as like broccoli. So make sure that you're getting that calcium, because calcium is very important for your bone health. And as we get older, we tend to be more likely to lose bone strength, lose some of our bone, that we develop osteoporosis. So we want to make sure we're getting that calcium in our diet. And the recommendation usually is 3 servings of dairy every day to have that. Another thing to be thinking about is protein. And particularly women, they're recommending that you may want to increase how much protein that you have in your diet. Now, protein actually will prevent muscle loss as we get older. And there's something else you need to do to also prevent that, but that's one of the things you can do, is by making sure you're getting adequate protein. Now, some of the foods that we get protein in are from our meats, our chicken, our poultry, our fish, and also some of our nuts, our legumes, and our beans have are good sources of protein. As people get older, sometimes they have problems with their dental health and they have difficulty chewing, and therefore their protein intake may decrease. So be looking for that if you have issues like that, or if you're caring for someone who may not be really eating as much protein as they used to, because they're not able to chew it well. There are things that you can do, and you want to talk to a registered dietitian or your healthcare provider to see what are some alternatives. It may just that you need to chop it up a little bit more, or make sure sometimes you need to go to more blending the foods. But that's more if they really have trouble with chewing the meats. The other things we want to limit, though, is that we want to limit those added sugars. And added sugars just add a lot of calories, but no nutritional value. And the nice thing is that added sugars are now included on nutrition labels. So you can look to see how much added sugar you're getting in a food when you look at the label. You also want to limit your saturated fats, which we've been talking about for many years, about limiting those saturated fats and eating the healthy type of fats that are unsaturated. And the other thing is to limit our sodium. Now, the recommendation in general is no more than 2,300 milligrams of sodium a day. But if you have some health conditions like high blood pressure or kidney disease, you may have more they be more restrictive than that 2,300 milligrams a day. So you want to check with your healthcare provider about that as well. Now, one nutrient that stands out as being something that's common for older people to become deficient in is vitamin B12. And the reason for that is some older adults are not able to absorb the B12 in the foods that they eat. So they may need to talk to their healthcare provider and have a supplement of B12. But be sure that you do talk to your healthcare provider before you take any specific supplements like that. A multivitamin is not going to give you enough B12, so you definitely need to talk to them if there's a concern that you're not getting that vitamin B12. Some sources of B12, there's lots of different foods in your diet, but chicken, liver, clams, salmon, and tuna, fortified cereal, beef, yogurt, milk, and eggs. So there's a lot of different types of foods that have that B12 in them. So you make sure that you're getting those and getting a variety of foods in your diet. Now, eating healthy is just one part of the equation of good health. And the other part is regular physical activity. And as we get older, we need to have that more because regular physical activity, particularly strength training exercises, help to prevent that bone loss and that muscle loss that we sometimes have. So it's important. The recommendations for your aerobic exercise, which is like your walking that you may do, or if you do any Zumba classes or things like that, it's actually 150 to 300 minutes a week. Now, we used to always just say 150. Well, now they're saying that's the minimum, but if you can do more, that's even better. So I always try to put that into 30-minute increments. And so if you said you did 30 minutes 5 days a week, you'd have 150 minutes. Well, maybe you do 60 minutes 5 days a week, then you're getting your 300. So try to get between 30 and 60 minutes at least 5 days a week to get that aerobic exercise in. Your weight-bearing exercises, your strength exercises that you do, you want to do those at least twice a week, maybe even 3 times, but at least two times a week. And then think about your balance training as well, because that balance training, balance exercises are really important to prevent those falls and to prevent any kind of risk of falls and hurting yourself and having some kind of injuries from that. So the guidelines really are there to help you to have a good quality of life as you get older, and also to try to remain independent for as long as you can and prevent any of those falls or fall-related injuries. So make sure that we work on what we're doing, what we're eating, as well as what we're doing with our bodies physically and doing some kind of activity with them. Healthy aging is possible, but we all have different stages. And one thing I always recommend to people is, as people get older, you don't want to be too restrictive with what you're eating, because that could be the only thing that person has to look forward to. So maybe 1 or 2 cookies every day is just what they really look forward to. And, portion control is important. And everyone's going to be at different things of what they need for their diet. So make sure you're talking with your healthcare provider, and if you need to consult with a registered dietitian to get more information to help you plan a healthy diet, then check that out. If you want information about the dietary guidelines, you can go to dietaryguidelines.gov.